Hello and welcome to Conversations with Kerry. Today's conversation is transitioning successfully into the new work environment. This conversation is brought to you by the College of Health and Allied Development. You may contact them at 561 270 7383 or apply online at www.apply.chadedu.org. Now, as Director of Education for a hospital, I've had the opportunity to introduce the new care environment to new hires. Now, nurses typically come in at various levels of preparation, meaning some have been nurses longer than others, and some may have a wider experience than others. Now, today's tips are applicable regardless of your level of preparation. This list is not all inclusive of what you should know. However, it delivers strategies that are essential to a successful transition. First and foremost, you need to know the services offered by your organization and the unit on which you're hired to work, and prepare yourselves ahead of time. Therefore, if you're hired to work on the cardiac unit, you want to review your cardiac system, your cardiac assessment, identifying cardiac abnormalities, medication tests, and procedures associated with the cardiac system. You also want to know what the facility's patient safety goals are, and you want to ensure that you have information geared towards taking care of your patient with the patient care and safety goals in mind. Know where to find resources, such as your policies and your procedures, and refer to them as necessary, and just review them whenever you can. Develop good working relationships with the team. This means your CNAs, your fellow nurses, your nurse manager, your pharmacist, physician, your environmental services aide, etc. They're part of the team because they all contribute to the patient care experience. Always be before time to get yourselves organized. Learn where tools and equipment are kept and learn how to use these tools and equipment. Always do walk-in rounds with the off-going nurse. This is your opportunity to visualize your patients, to ask any questions of the off-going nurse, and to get your first turn off the shift. Also, ensure that you document as you complete a task. As we know, if it's not documented, it is not done. However, also keep in mind that other members of the team depend on your documentation in assisting with patient care related plans. For example, the physician depends on you to document patient response to medications, patient's vital signs, etc., so that he can develop a new plan of care, adjust a new plan of care, or decide whether to keep the current plan of care. So that's very important. Cannot impress that upon you enough. Round according to the facility's policy. Always use your S bar when you're communicating with physicians. Attend your staff meetings. They are a really good source of information and knowledge. And last but not least, attend all your in-service education that is offered by your facility. Thank you so much for spending this time with me. Until next time, this is Conversations with Kerry.